Serotonin syndrome. You got too much serotonin. There is too much of a good thing.
Yes.
Okay. So this would happen if you were taking like more than one SSRI, or you were taking an SSRI and an SNRI, or you were taking an MAOI and a TCA. Like when you start mixing them and they all have serotonin in them, then you could get serotonin syndrome. And what herb is notorious for causing serotonin syndrome? St. John's wort. Okay. So this is just a reminder that 90% of your serotonin comes from the gut. Only 8% comes from your platelets and 2% comes from your CNS. So guess how we treat depression? By treating the CNS. What in the... Yeah, it doesn't make any sense, right? And y'all do know that they have for 40 years said that depression was a chemical imbalance. And then that's why they gave millions and millions of patients antidepressants.
My mom still says that.
No, they came out in a major research study and said, sorry, that was wrong. We gave 40 billion people antidepressants, and it really has nothing to do with a chemical imbalance.
Oopsie.
So here we are. Anyways, all right, so serotonin syndrome actually can be life-threatening. What is your keyword for serotonin?
Happy.
Happy. This is an upper. So what happens if you get massive amount of upper stimulants? Okay, so everything is majorly sped up, right? Okay, so you're going to be sweating. You're going to have massive fever. The hyperthermia can kill you. Okay? They're going to start massively sweating. You could get dehydrated. Yes?
Are they really happy or no?
No, it's just like a massive stimulant. Okay. They're not feeling happy when they have sweating, fever, agitation, confusion, akathisia. Yeah. No, it's not like you're so happy. Like it's like you're so sped up that you like your heart is racing, so you feel super anxious. Like this is not a happy time. Okay. They will have severe anxiety. They're going to be agitated, right? Yes. Okay. What is akathisia?
Their movement?
They can't sit still. They're moving like this because their body is like, it's up, it's up, it's up, it's up, it's up. Okay. They look like hypomania. Okay. They'll have massive tachycardia. That can cause dysrhythmias. Massive hypertension. Everything is up, 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 right? What's their worst case scenario with the hypertension? They're going to stroke out. They're going to have massive diarrhea, which can lead to electrolyte imbalances, fluid imbalances, tremor, shaking, hyperreflexia. This is bad. This is bad. So the first thing you're going to do is to stop their meds. Now, this is the only time you can just discontinue it because if we don't, they'll die. Okay? So you're going to give massive IV fluids, right? We're going to do all kinds of cooling measures to cool this patient down because their temperature may be 105. This is very bad. Okay? They're going to get some oxygen. Okay? We're going to put them on an EKG because their heart rate may go so high they may go into like VFib. That's bad. And then we're going to sedate the shit out of them. We're going to give them massive amounts of benzos to bring everything down. We're going to give antipyretics to help with the fever. What are cooling measures? What are things that we do to cool down a patient?
Cool rag, maybe?
So cool rag on the forehead. We put ice packs in the axillary and the groin. We'll put a cooling fan. So we'll wet down the patient because you can't put the full patient in ice because it'll cause shivering and then it increases the temperature. But you can put ice packs in the axillary and the groin and like behind the neck, and then you will wet down the patient and then put a cool fan so they can evaporate. Okay. There's also cooling blankets. We can give cooled IV fluids. Okay. And then cyproheptadine is going to slow down the gut. It's going to slow down everything. Okay. You have to monitor for rhabdo. How do I know this patient has rhabdo?
They release like creatinine, myoglobin, like those?
Yes, they will release those. You're giving me the patho of rhabdo, but how do I know with my eyes that they have rhabdo?
Muscle pain? Like they're shaking like really hard and like.
Okay, let me ask you this: what's the worst case scenario of rhabdomyolysis?
Lactic acidosis.
Okay, they will go. I mean, yes, they will increase in lactic acid, but okay. Let's start over. What is rhabdomyolysis?
Your body releases. I only know what it is. Muscle breakdown.
Okay, it's this muscle breakdown because they're shaking so much and they have all these, so their muscle can start to break down. What are the two main byproducts of muscle breakdown? Myoglobin and lactic acid. So lactic acid can build up in the body. It'll make them feel very sore, and yes, it can cause acidosis. Where does the myoglobin go? How does it get released out of the body? To the kidneys, and it rips through the glomeruli. So how will I see with my eyes that they have rhabdo? All of a sudden, you'll look at that urine bag, and they'll have bright red bloody urine. Hematuria. Okay. So you need to watch for that too. You got to watch dysrhythmias. We may need to treat them even with antidysrhythmics, right? So we are trying to just slow down this patient, okay? So this is just a reminder. I already told you about St. John's wort, but remember your migraine meds increase serotonin. Oh, y'all haven't had that yet. We haven't had that.
No.
Okay, they end in tryptin.
Yeah.
Okay. Your migraine meds are serotonin agonists. So if you have a patient, and it's very common to have depression and migraines together, so you need to make sure that you do a med reconciliation, which means when somebody comes in, I'm going to look at all the meds that they're on. And if this lady, like I see she has a history of migraines and she's on a triptan, you need to notify the doctor to let them know, like, hey, she's already on a triptan. Do you want to switch her to something else? Because you're also giving her an SSRI and she's going to end up in serotonin syndrome. Do you understand?
Yes.
All right.
Given
Triptans are
Or
migraine
Botox,
meds.
right?
Ergotamine doesn't cause
Wait,
serotonin
so you're
syndrome
saying
as
you
much.
can't give triptans with SSRIs? Is that what you're saying?
Right, you can't give triptans with anything that increases serotonin. So that would be SSRIs, MAOIs, TCAs. All of those increase serotonin.
Okay.